Did you know that every 80 seconds, a woman in the United States dies from heart disease? Yep, you heard that right. Heart disease doesn't just affect men, it's the leading cause of death in women. Yet many of us don't know the symptoms, risk factors, or how to protect ourselves. Hi, I'm Dr. Esra Shermadou, board certified family medicine physician, and today we're talking about why women are uniquely at greater risk of heart disease and what you can do to keep your heart healthy. Stay tuned to the end to learn what you can do to protect yourself. Let's start with why heart disease is such a big deal for women. Despite being the #1 killer, heart disease is often overlooked in females because our symptoms can look very different from those in men, and they can be very vague and nonspecific. Some warning signs to be aware of include unexplained fatigue, shortness of breath, nausea or vomiting, lightheadedness or dizziness, pain or discomfort in the neck, jaw, shoulder, upper back or abdomen, and even cold sweats. So very nonspecific and vague. Why are our symptoms different from those in men? It's due to how plaque builds up differently in women's arteries. Instead of forming one big blockage, it spreads along the artery wall, making symptoms much more subtle. There are a few key risk factors for heart disease to be aware of. These include hypertension or high blood pressure. High blood pressure damages blood vessel walls and increases the strain on the heart. This means that your heart now has to work much harder to push blood out to the rest of the body. And this increase in work over time can lead to heart attacks. Diabetes is another risk factor. High blood sugar can damage blood vessels and the nerves that control your heart. High cholesterol. Too much LDL or bad cholesterol can lead to plaque buildup, and this decreases blood flow to the heart. Smoking is another risk factor, and it's one of the most significant modifiable risk factors. If you do smoke, talk to your doctor about ways to help you quit. Obesity. The increase in weight increases the strain on your heart, again, making it work harder. A sedentary lifestyle. Lack of physical activity can lead to poor heart health. Your heart is a muscle, so exercising it strengthens your heart just like it does the rest of the muscles in your body. Family history. If your mom or sister had a heart disease, this increases your risk of developing heart disease too. Hormonal changes. Estrogen has a protective effect on the heart, so cardiovascular risk increases after menopause. In fact, studies show that women who undergo surgical premature menopause, they have been found to have higher risks of cardiovascular disease compared to women without premature menopause. One interesting factor to consider in females is estrogen. Estrogen helps keep our blood vessels relaxed and open, and it also supports healthy cholesterol levels. That's why before menopause, women generally have a lower risk of heart disease compared to men. But once estrogen levels begin to drop, the risk of heart disease starts to go up. Most studies are now showing that hormone replacement therapy started within 10 years of menopause or less than 60 years of age might have a protective cardiovascular effect. So be sure to talk to a menopause-trained provider to see if it might be helpful in your case. And before we get into all the things you can do to protect your heart, let me know if you're finding this video helpful. And if you are, please don't forget to hit that like button, subscribe, and share this with someone you care about. And let me know what questions you have in the comments. All right, now let's get into the important part. What can you do to protect your heart? Prevention tip #1, know your numbers. Regularly check your blood pressure, cholesterol, and your glucose levels. If you're unable to control these factors through diet, exercise, and other lifestyle changes, starting on medication can decrease your risk of heart disease. #2, move your body. Aim for at least 150 minutes of moderate exercise a week. #3, eat heart-healthy foods. Prioritize whole grains, fiber, lean proteins, and healthy fats while cutting back on sugar and processed foods. #4, manage stress. Chronic stress can increase your heart disease risk. Try relaxation techniques like meditation or yoga. And #5, quit smoking. If you're a smoker, quitting is the single best thing you can do for your heart. Taking care of your heart doesn't mean completely overhauling your life overnight. Start small. Add a short walk to your routine or swap out sugary snacks for fruit. Even small changes add up. Remember, be your own advocate. If something doesn't feel right, speak up. Your heart health is too important to ignore. All right, that's it for now. Let me know if you found this video helpful and subscribe to the channel. Also, let me know what other health topics you'd like to see. All right, see you guys next time.